Hi guys, the topic of the day is Nevirapine versus Ritonavir boosted lopinavir for HIV infection in children. The definition: what is Nevirapine? It is a non-nucleoside reverse transcriptase inhibitor used to treat HIV-1. The bad thing about HIV related to this drug is that HIV rapidly develops resistance if nevirapine is used alone. So the doctors recommend that they use a therapy that consists of a combination of 3 more antiretrovirals. Since we're talking about HIV, here's a little bit more information about this disease.
What is HIV? Everybody has an immune system. The immune system is made up of lots of specialized cells designed to recognize any foreign cells that enter the body and cause illness. Some of these foreign cells could be bacteria, which can cause a sore throat, or a virus, which can cause a cold. When a foreign cell enters the body, your immune system will respond in 3 simple steps. Step 1. It will recognize that there is a foreign cell in the body. Step 2. It will then send a message for the immune cells to destroy the foreign cell. Step 3. It will take a point of remembering the foreign cell, set up a memory system so that if the cell returns, then the body will be able to react more quickly against it. HIV is a virus which attacks a human's immune system, making it more difficult for the body to fight infections. HIV stands for Human Immunodeficiency Virus. Once the HIV virus has entered the body, the virus will target one of the specialized cells in the immune system, called CD4, which help organize the body's response to fight against foreign cells. The virus gets inside the CD4 cell, replicates itself, and infects other CD4 cells around it. In doing so, it gradually depletes the CD4 population, making the body weak and less able to fight off infections. If the amount of virus in the body is fairly low, there are not many symptoms, but the more HIV virus is able to replicate over time, the more it will have an effect on the body's immune system, making...
So yeah, continuing with applications in medicine, what are the uses of this drug? The main use is that it suppresses viral load effectively when it is used as an initial antiretroviral therapy. It prevents also the mother-to-child transmission by 50% compared with a very short course of another drug, which is Zidovudine. And here's a video of how these drugs work. Here are the current antiretroviral medications. Side effects: lactic acidosis and hepatic steatosis, lipodystrophy, also gastrointestinal intolerance, pancreatitis, headache, bone marrow suppressed, rash. This is very important. Rash and Stevens-Johnson syndrome, hepatotoxicity, and it also has drug interactions. We move on. Here are a little bit of the side effects. The most common one is severe to moderate rash, which is present in about 50% of the patients that take this medicine. Other life-threatening side effects include the Stevens-Johnson syndrome, toxic epidermal necrolysis, and hypersensitivity. Now, what is the mechanism of action? So this drug is going to bind directly to the reverse transcriptase, and it's going to block the RNA-dependent and DNA-dependent DNA polymerase activities by causing a disruption of the enzyme catalytic site.
HIV-1 is a virus with a high replication rate. Within infected CD4 cells, the viral nucleocapsid breaks open, releasing 2 RNA strands and essential replication enzymes, such as HIV-1 reverse transcriptase. It is a heterodimer with a p51 subunit and a p66 subunit. The p66 subunit contains a finger, a palm, and a thumb region, resembling a cupped hand. Reverse transcriptase has 2 catalytic domains, the ribonuclease H active site and the polymerase active site. Here, single-stranded viral RNA is transcribed into a RNA-DNA double helix. Ribonuclease H breaks down the RNA. The polymerase then completes the remaining DNA strand to form a DNA double helix. This proviral DNA contains the genetic material of HIV-1. Therapeutic suppression of viral replication slows down the decline of CD4 cells and disease progression. Nucleoside reverse transcriptase inhibitors, NRTIs, inhibit the polymerase active site. After metabolism to non-functional nucleotides, their incorporation causes chain termination. The non-nucleoside reverse transcriptase inhibitors, NNRTIs, form another class of powerful antiretroviral agents. They inhibit reverse transcriptase by reducing its conformational flexibility. The thumb region of reverse transcriptase is flexible. It opens and closes like a hand. Only the closed position allows transcription of RNA. The base of the thumb has a hydrophobic, pocket-like binding site. This is the target of NNRTIs. Nevirapine is an important representative of this class. It does not need to be metabolized. In its native form, nevirapine binds in the pocket. This locks the thumb in the open position and prevents the transcription of RNA. Thus, nevirapine stops viral replication. Due to this mechanism, nevirapine is a potent partner in the combination therapy of HIV-1 infection.
So it refers specifically to the drug that we're talking about right now. So what this study was about is that these people, what they did they did a randomized study in which they compared the initiation of HIV treatment with this medication, which is a cytidine, the lamivudine, and either the nevirapine or the ritonavir boosted lopinavir in HIV-infected children going from 2 months until 36 months of age, who had no prior exposure to the medication nevirapine. So after they recollected the result, they came to a conclusion in which the outcomes were superior with ritonavir boosted lopinavir among young children with no prior exposure to nevirapine. The pros about this medication is that it prevents HIV transmission from mother to child, as we said before. I also investigated about the cost of this drug, which is it varies from $25 to $27 in the US, and it also includes 60 tablets, so it's relatively not that expensive. If prevented, the child can enjoy a normal life, obviously. And the consequences, the bad things about this is that this medication has a lot of side effects, as we already saw, including nausea, pain in your upper stomach, loss of appetite, dark urine, clay-colored stools, jaundice, which is the yellowing of your eyeballs, also fever, chills. Sorry for the misspell right there. And also another thing is that it's still being studied, its efficacy, as this study. And related disease is toxoplasmosis, which is a parasitic disease caused by the protozoan Toxoplasma gondii. And the symptoms are often influenza-like, which include swollen lymph nodes or muscle aches and pains all over the body. The still in a generalized way, the treatment is this combination of drugs right here. And here's a little bit more about toxoplasmosis. It's loading. There we go.
Toxoplasmosis is one of the most common parasitic infections throughout the world. According to one estimate from the Centers for Disease Control and Prevention, up to 1/4 of Americans may be infected, and 1/3 of the world's population. But you might not know you have the disease, which typically has no symptoms. However, to people with compromised immune systems and pregnant women, it can be deadly. Humans become infected with toxoplasmosis by ingesting food and water contaminated with oocysts from infected cat feces, or by ingesting tissue cysts in raw meat from infected animals. At the National Institute for Mathematical and Biological Synthesis, Dr. Xiaopeng Zhu is co-organizer of a workshop in which a multidisciplinary group of scientists will study Toxoplasma gondii, the parasite that causes infection.
This is the first workshop on mathematical modeling of T. gondii. This workshop is different than other meetings of toxoplasmosis in that we are trying to address a number of interdisciplinary
So here's the summary of the video, and that was the whole video. Thank you for watching.